Hello, I'm Geraint Hardy and welcome to the Healthy Work in Wales podcast brought to you by Public Health Wales. Over the series, we'll be chatting to experts about a range of workplace health issues, empowering employers with the knowledge and support they need to help keep the Welsh workforce healthy and in work. In this episode, we're talking about mental health in the workplace. According to recent stats, 2 in 5 people are said to have suffered from poor mental health where their work life was a contributing factor. And 70% of managers said that there were barriers to being able to provide support to these individuals. My guest today, Faye McGuinness, is the head of the Workplace Wellbeing Programme at mental health charity Mind. She has significant knowledge of the issues faced by both employers and employees when it comes to mental health in the workplace. Faye, a very warm welcome to you. Thanks for joining us today. Let's get straight into it if we can. From your perspective, what's the biggest issue relating to mental health and the workplace currently then?
So what we know in regards to workplace mental health is that at the moment, the kind of biggest issue is around presenteeism. So that's people who are in the workplace but are not being able to be as productive as they can be because they might not be feeling at their best in terms of their mental health and well-being, or they're not being able to be as productive as they could be because they're not getting the right support. So in January this year, Deloitte carried out a review which looked at the business case for employers in relation to mental health at work. And what that report showed us is that the cost to UK employers of poor mental health at work is between 42 and 45 billion pound each year. And 29 billion pound of that is due to presenteeism costs. So in terms of the kind of main issue at the moment, it's around people being in the workplace but not feeling at their best, so not being able to be as productive as they could be.
My next question was obviously going to be something on the lines of what's the overall picture across Wales and the UK? But obviously with them kind of stats, it's a pretty kind of worrying overview of the whole thing.
Yeah, absolutely. So like I said, a cost of 45 billion pound to UK employers. So that's made up of absence costs, so people being off because of poor mental health, the presenteeism cost that I spoke about just now, but also turnover costs. That's around 8.6 billion pound. So we know that many people are obviously leaving their job because they're not getting the right support, and there's a huge cost in having to recruit other people. And then when we look at the cost to employers per employee per region, we know that for Wales, the cost per employee is £1,557. So we're able to see what those costs are per region. And we know that the cost per employee is highest in London, but actually when you look at the cost as a proportion of earnings, the highest is actually in Yorkshire and the Humber and in Wales. So in terms of the kind of financial cost to Wales, we know that that is quite huge. But we can't forget that this isn't just about the money. We're talking about people. We know that around 300,000 people every year are falling out of work because of poor mental health. And that's a huge number of human beings that we're actually losing. So I think it's really, really important to acknowledge that there is a huge financial cost to businesses and to the economy, but we are talking about human beings here. So it's a really, really important issue. And it's why it's so important now that employers prioritise the mental health and well-being of their staff.
So why do you think this is happening? In the workplace, for example, what do you believe are the biggest contributing factors to poor mental health?
Yeah, so we know that there are many, many people that are going into work and are working long hours. So this is going to vary from sector to sector, and it's going to vary from individual to individual because everybody's different. But we know that there are some drivers and there are some factors. So we know that people work incredibly hard. So there are sort of working practices such as long working hours, for some people working irregular shift patterns, for some people the kind of organisational culture within their organisation. So that culture of people feeling like they're not able to talk about their mental health, and people not feeling like they're able to get the right support until maybe they're in crisis. So that kind of culture is really important. But we also know that there is a lack of confidence from some employees in their line managers to support them, and they don't have that relationship where they openly about their mental health. So there are many factors at play here. It is very complex and complicated, but if we were to kind of break it down, I think we would say there's something around the culture piece, and organisations maybe not quite creating the right cultures where people can talk about their mental health. Then there's also the piece around how we design work, and we design offices, and we design the way that people have their work and life balance, and maybe that balance isn't correct at the moment. And then there's a sort of a capability issue here around, making sure that line managers and leaders have the right skills and tools to support people around their mental health.
So that's the current overview, if you like, in a snapshot. So given the high numbers of people suffering from mental health issues in the workplace, as an employer, is there a legal responsibility to provide support?
Yeah, so people with mental health problems are protected under the Equality Act. So absolutely, there is a legal responsibility. I think there is an understanding that the Equality Act, from our perspective, needs to be relooked at, and it needs to be made much clearer about what that responsibility is from employers to support employees. The Equality Act talks about mental health problems and people that have long and enduring mental health problems, but we obviously know that mental health can fluctuate for individuals. So we are currently at Mind sort of campaigning for the Equality Act to be relooked at in terms of mental health. But absolutely, an employer has a legal responsibility under that act to make sure that anybody with a mental health problem gets the right support.
And does the responsibility lie solely with the employer to improve mental health in the workplace, or does the employee have a degree of responsibility as well?
Yeah, so we know that that many employees don't feel comfortable to disclose their mental health, and so that for us is a major issue. We want employers to create an environment where staff feel able to talk openly about stress and poor mental health at work, including any issues that they're facing. So we first and foremost need employers to create that environment, and we need to make sure that there are things in place that make employees feel comfortable to be open about their mental health. But also as individuals, whether we're an employee, just as a human being, we all have responsibility to look after our own mental health and well-being in the same way that we would look after our physical health and well-being as well. So I think that, there are many things that we can do to look after our own well-being. So there's lots of stuff that we have around kind of building resilience, kind of learning about our own selves and what keeps us well and healthy. We talk about things such as wellness action plans, which is about them identifying the things that keep them healthy at work, and employees can share those with their managers to create those conversations. So we absolutely do, as ourselves, have a responsibility to realise and look after our own mental health. But we have to recognise that for many people, they're still going into workplaces where that culture doesn't allow them to talk openly about their mental health and well-being. So that has to go alongside the culture piece.
Is the feedback you guys are getting that them conversations have been had within the workplace?
So we're absolutely seeing improvements. So there's been a huge amount of work done across the Time to Change campaign, which is all about breaking down stigma and enabling people to talk about their mental health. And as part of that campaign, there's been a huge amount of work done with employers around the Time to Change pledge to get organisations to talk about mental health much more. So we are absolutely seeing improvements in some organisations. In terms of the kind of national picture, we're not seeing the improvements that we would want in terms of people feeling comfortable to talk about their mental health. So in a recent report by Business in the Community, we saw that over 50% of people said that they still wouldn't have a conversation with about mental health with their line manager. So that's still too high. So yes, so I'd say we are seeing improvements, but we still have a long way to go.
Okay, so a small example, I'm sure many employees have found themselves in this situation as well. So I've recognized that an employee of mine has mental health issues, but they've not formally disclosed them. Do I still have a requirement to support them?
Yeah, so like I say, every individual has the right to make a decision as to whether or not they want to disclose their mental health problem. And I'll go back to the point that I've made again, is that many people won't disclose because of fear that there is stigma attached, fear that they're going to be judged, fear that they're going to be looked upon as they're unable to do their job, or any career prospects in that organisation are going to vanish because they're not trusted because they have a mental health problem. So that culture piece and environment piece is really, really important. But every individual has an individual choice to make as to whether or not they disclose. But an employer does have a responsibility to promote mental health and well-being, and to make sure that those people within their organisation get the time off if they need it to recover from being unwell. So what we talk about is kind of a good place to start for employers is to conduct an anonymous staff survey. And what that should do is help highlight where an employer is kind of doing well, but also where there is room for improvement. So that's not necessarily asking people to disclose their personal information, but what it does is give the employer a good opportunity to think about where they can start creating better working environments. And then what we would recommend is employers put in practical solutions such as setting up EAPs, employee assistance programs, and start to think about some of those things that they can offer around flexible working, sort of buddy systems, all of those schemes that we know have a really good impact on mental health. So for us, it's about the employers doing all that they can to create those environments and really to look at that kind of early intervention prevention piece where possible, and then recognising that they will have people in their organisation that do have mental health problems and will need support. So making sure that support is in place. So every individual has the right to make their own choice as to whether they disclose. Obviously, if an employer doesn't know that somebody has a particular mental health problem, they might not be able to give them the kind of tailored, dedicated support that person might need. But absolutely, the organisation should be creating the environment where those employees can actually disclose and get the right support.
And Faye, what if they haven't disclosed their issues, but you believe that their work is being affected as a result of these issues? Can you intervene?
Yeah, so if an employer believes that an employee's work is being affected by their mental health, so if we take that example that an employer sort of notices that an employee maybe is not working at their best, we go back to that whole productivity presenteeism point. So what we would say is first and foremost taking a proactive approach to promoting staff wellbeing and tackling the work-related causes of stress and mental health is the very first thing that people should be doing. And we know from what I said earlier that it makes good business sense because it results in increased productivity, morale and retention. And employees need that reassurance that they're going to be experiencing the support that they need. But if as an employer you are worried about somebody, then actually what employees should be doing or a line manager should be doing is talking to that person. Actually staying silent is probably one of the worst things a line manager can do. So the kind of rules of thumb that we follow are, encourage people to talk. So, if you have one-to-ones with your staff member, if you have a wellness action plan already with that person, use that as a kind of template. But start by talking maybe about general well-being and letting people know what support is available if they need it. And line managers should remember that everyone's experience of mental health problems is different. So, focus on the person rather than the problem. And then I think it's really important that we don't make any assumptions. So, don't try and guess, what kind of mental health problem somebody might be experiencing. And then obviously, there's about respecting confidentiality. So I think as a line manager, if you are worried about somebody, the first thing to do is to have a conversation, give that person the space if they do want to open up and have that conversation. If they're not in the space to have that conversation with you, then it's about reminding them of what's available, your employee assistance programs. If you have any peer support, what other offer do you have available that might enable them to go and get that support?
And what happens, Faye, if an employee hasn't disclosed a mental health issue and then because of that, they go off sick?
Yeah, well, it's interesting actually, because a recent survey by us at Mind found that 43% of employees said that they would be unlikely to confide in anyone at their workplace in the future if they were experiencing an episode of poor mental health. And, all of the research kind of indicates that. So, Business in the Community found that 1 in 10 employees who disclosed a mental health problem at work said that they faced demotion or a disciplinary procedure or even dismissal as a result. So it's not really a surprise to us that people are kind of staying quiet. But I think what we do is we want to encourage staff at all levels of seniority to talk about their experiences. And, so we talk a lot about sort of CEOs and directors who can really help kind of challenge those outdated and negative attitudes. And so all of that stuff that I've spoken about creating that culture should help enable employees feel like they have the ability to access that support before they go off sick. Because actually we don't want people getting to the point where they have to go off sick if we can obviously avoid that. But equally, we recognise that people, if they need to take that time, should be given that time. So if an employee hasn't disclosed a mental health issue and subsequently goes off sick, then they still are protected by that Equality Act, by the fact that they have a mental health issue. And we would recommend that line managers provide them the same support as they would provide anybody. And actually, if somebody has gone off sick, then for us, it's about finding out from them about how they want to keep engaged with the organisation, how often they want to be checked in with. And when they come back to work, it's about providing a return to work meeting and taking those steps that I spoke about previously about how you might approach somebody to talk about their mental health. We can't force anybody to disclose their mental health issue, and particularly in a workplace where we know that there are many reasons why they can't. But I would just recommend that we continue to try and put those preventative measures in place and to have those open conversations so that hopefully that person can eventually feel comfortable enough to disclose.
And obviously, there are many other factors to poor mental health apart from work. 50% of employees have cited poor mental health due to causes outside of work. So how can employers provide additional support when people are struggling with personal issues or when there are wider societal challenges kind of affecting their health?
Yeah, I mean, we know that people are not just people in work. They're not just employees. People are humans. They have a human life outside of work and have many factors that impact on mental health. But what we know is that even though 50% of the causes are directly linked to work, 50% are outside of work, that work can be a place where people can come and get the right support and also have the ability to really thrive. And that can only be a good thing for somebody if they're experiencing poor mental health. So what we're seeing some really good employers do is they are providing, support around kind of financial management, around support if you're a parent or if you're a carer. And so some really good employers are starting to understand all of those different factors that impact on somebody's mental health. And as an organisation are trying to provide support for their employees around those areas. Because actually what they recognise, if they're able to support employees around those areas, their employees will come to work feeling happier, more productive, more engaged. And that is only ever going to be a good thing for an employer. So I think we have to absolutely recognise that it's not all work-related issues, but if there are things that a workplace can do to provide information or support for those areas, then I think that's only going to be a benefit to an organisation.
And if we strip back any legal requirements, stats or guidelines, on a human level, why should employers be invested in supporting the mental health of their employees?
Yeah, so I think you're right. And I'm really conscious that I've kind of put out quite a lot of stats and, we have spoken about the legal stuff. And whenever I do presentations like this, what I usually do if I'm, physically in front of people is I would usually start with a kind of human story, a video and somebody's experience, because I think that really brings to light why this is a human issue over anything else. Workplaces thrive because of their people.